Welcome to OSBT Standard Procedure
100.
Hazard Communications Employee Education. Basis for this course. Our hazard communication program comprises the following elements: assignment of responsibilities, material safety data sheets, container labeling, employee training, and record keeping. This program establishes uniform requirements to make sure that the hazards of all chemicals handled, used, or stored in the workplace are evaluated, and that this hazard information is transmitted to all affected employees by means of labels on containers, review of material safety data sheets, and employee safety training. Through this program, our employees will receive the necessary hazard information, and our company will take the steps to reduce exposures, substitute less hazardous materials, and establish proper work practices. Management recognizes our employees' use or handle chemicals that may cause harm to its employees. Thus, management has implemented a hazard communication program. The program is based on the premise that our employees have the right to know the identity of chemicals in their workplace and the hazard that they may pose, and also have the right to know if protective measures are needed to prevent the occurrence of any adverse effects from hazardous chemicals. What is hazard communication? Hazard communication, or HazCom, is our program where we tell you about the hazardous chemicals used and stored in our workplace. We will also train you on how to protect yourself from the effects of these hazardous chemicals. What is a hazardous chemical? A hazardous chemical is any chemical that can do harm to your body. Most industrial chemicals can harm you at some level. It just depends on how much you get into your body. Some chemicals are more toxic than others. Just a little bit of some chemicals entering your body can harm you. Others are much less toxic, and it would take larger amounts to do any harm. The training will show you the exposure to chemicals can come from many different sources. How do hazardous chemicals affect the body? It depends on several factors: how the chemical enters the body, the physical form of the chemical, the amount of chemical that enters the body or the dose, or how toxic the chemical is. A poisonous chemical will not do any harm to you, obviously, if it does not enter your body. How chemicals enter the body. There are 4 routes of entry. First, ingestion, swallowing the chemical. Then inhalation, breathing in the chemical. Then absorption, a chemical can soak in through your skin. And lastly, injection, a chemical can enter your body through an accidental impact, cut, or a puncture in your skin. To become harmful, a chemical must first enter or come in contact with your body, called the routes of exposure. For example, depending on which type of chemical in the manner it is handled, it may enter through inhalation, which is the most common way chemicals can enter through your body, or something like skin absorption, which is less common but can occur with solvents and pesticides. Ingestion is usually not a major problem in the workplace, but it can happen in certain situations. Inhalation, breathing. Inhalation involves airborne hazardous chemicals that can be inhaled directly into the lungs through the nose or mouth. These chemicals include dust, mist, fumes, vapors, and gases. Where the particle or mist settles in the respiratory tract determines what symptoms or disease will develop. Some chemicals settle in the nose or throat. Some go deeper into the lungs. Chemicals that go deeper into the lungs often cause more damage. Fine dust usually goes deep into the lungs. So how do you prevent this? Personal protective equipment that provides protection from airborne chemicals includes respirators or masks, and they're appropriate for the specific contaminant. Skin absorption. Absorption involves hazardous chemicals that are absorbed directly with contact through the skin or the eyes. Chemicals can include particulates like dust, smoke, or liquids, gases, and vapors. These chemicals can cause various different health effects. So how do you prevent this? Absorption through the skin or eyes can be prevented with the proper use of appropriately selected gowns, gloves, work clothing, personal protective equipment that covers the eyes, such as full face masks, safety glasses with side shields, and face shields, appropriate for the specific contaminant. And in some instances, a full hazard suit with a head mask is appropriate. Ingestion or swallowing. Chemicals that are swallowed are absorbed in the digestive tract. Chemicals can rub off dirty hands and contaminate food, drinks, or tobacco products. Chemicals in the air can settle on food and drink and then be swallowed. Prevention. Good hygiene practices are important for preventing products from being ingested. In areas where harmful chemicals are handled, eating and smoking should not be allowed. In a situation, carefully and thorough hand washing is required before eating at the end of every shift. Inhaled toxic dust can also be ingested in amounts that may cause trouble. In these situations, appropriate barriers such as dust masks are necessary. Injection. Injection may occur through the misuse of syringe needles or through accidents with broken glass or other sharp objects that may have been contaminated with chemicals. Injections can also occur through high-pressure streams of liquids or gases. Prevention. Cautious use of any sharp object is important. No proper storage, handling, and disposal procedures of syringe needles, glassware, or other potentially sharp objects. Wearing gloves and other protective clothing may also reduce the possibility of injection. This is another good reason to wash your hands before eating, drinking, and smoking. The three forms of chemicals. All chemicals exist in one of these three forms: a solid, a liquid, or a gas. The physical form of the hazardous chemical can affect how hazardous it is when it enters the body. Hazardous chemicals, dusts. Some chemicals are solid in the forms of powders or dust. Dust can be released into the air by cutting, drilling, grinding, or sanding. Dust can also be stirred up by dry sweeping and inhaled. Dust or powders can be inhaled when they become airborne. For example, cutting a brick or a cinder block without water can generate lots of airborne dust that may contain quartz. Dry sweeping can do the same. If silica dust is inhaled, it can scar lungs and cause breathing problems. Hazardous chemicals, dust. Dust in the air can settle out on work surfaces, cups, plates, utensils, and food. The settled dust can be swallowed with foods or drinks. If the dust is hazardous, then it can cause health problems. Solids, fumes, and fibers. Fumes are extremely small droplets of metal formed when a metal has been vaporized by high temperatures, usually welding. Some solids are fibers which can be similar to dust, but they have an elongated shape, like asbestos or fiberglass. Metal fumes are formed during welding. Because of their tiny size, they are easily inhaled deep into the lungs and can be absorbed by the bloodstream. Sometimes the word fumes is used for chemical gases in the smoke and air, but this is a more accurate definition. Asbestos is one of the most hazardous dusts in fiber form because the damage it can do to the lungs. Fiberglass does not damage the lungs, but it can be irritating to the nose or throat. Hazardous chemicals, liquids. Liquid chemicals in direct contact with the skin can cause skin problems. Some liquids can be absorbed into the body through the skin. Liquids can be sprayed in the form of mist or evaporate in forms of vapor, which can be inhaled. Typical hazardous liquids are in various types of solvents. These chemicals can dry out the skin, cause allergic reactions, or have other direct effects on the skin. Some liquid solvents are flammable and can be a fire hazard as well. Liquids, mist. Mists can also be inhaled. Mist can settle on the skin and be absorbed into the body. Airborne mist can also settle out and contaminate food or drink. The most common exposure to mist is from inhalation. A common example of mist exposure at work is paint overspray. Hazardous chemicals, gases and vapors. Gases are chemicals that are at the gas phase at room temperature. Vapors evaporate from substances that are liquids or solids at room temperature. Gases and vapors enter the body through inhalation. Chlorine and methane are examples of gases. Most liquid solvents release vapors. Examples are acetone, paint thinner, and gasoline. Gases do not normally pass through the skin. Corrosive chemicals, inhalation and eyes. Inhalation of corrosive mists or vapors can cause severe bronchial irritation. Corrosives are especially damaging to the eyes. Goggles are essential to protect the eyes when handling strong corrosives. Eye washes are required where corrosives are handled. Damage to the eyes can be minimized by quick rinsing to the eyes. The photo shows an eye that is severely damaged by a corrosive. Hazards of metals. Metals can both be physical hazards and health hazards. Some metals can ignite and explode, magnesium or dust fillings in other metals such as aluminum. Some metals are almost non-toxic, iron, aluminum. Some metals are very toxic, mercury, lead, cadmium, beryllium. Metals can present different hazards from poisoning to explosions and fire. Metals can cause health effects such as elevated blood pressure, brain damage, kidney failure, and death. Pieces or articles of metal are not usually hazardous. It's when they're found in other products or are welded, cut, or grinded, creating dust or fumes that can be inhaled. A few metals can actually burn rapidly and intensely if they are in powder form. Airborne dust and fillings of some metals such as aluminum can explode when ignited. Some metals such as carcinogenic, examples chromes, are found in paints or metal plating. Chemical exposure limits. Many chemicals have exposure limits or allowable amounts of chemicals in the air. These limits are often called permissible exposure limits or threshold limit values. They are based on an 8-hour average exposure or ceiling or peak level. Levels must be kept below for limits to be safe. Permissible exposure limits, also called PELs, and the threshold limits, which are called TLVs. OSHA regulations have PELs for about 600 chemicals. The limits are usually expressed as parts per million or milligrams per cubic meter. Your exposure to the chemical should never exceed these limits. Personal protection equipment, PPE. Gloves. Protective gloves protect your hands from chemical exposure. Gloves are available in a variety of materials. Consult the MSDS and choose the right glove for the chemical you are using. Chemical splash goggles. Should be worn when there is a risk of splashing chemicals in your eyes. Normal safety glasses designed for impact resistance, not for chemical protection, and should not be relied upon when working with something that could chemically splash. Personal protective equipment, PPE, face shields should also be worn along with chemical splash goggles when working with corrosive chemicals such as strong acids and bases. This practice protects your face as well as your eyes. Splash aprons. Protect your body against corrosive chemicals. If you are handling a corrosive material in such a way that is present for a significant splash hazard, such as pouring the contents from one container into another, splash aprons are needed. Respirators. They may be needed if you have significant exposure to vapors, fumes, or mist of any hazardous material. How do you get information about hazardous chemicals? You can get information in two ways. From the Product Material Safety Data Sheet, the MSDS, or from the product label. Labels are sketchy and don't always have information about hazardous chemicals in their products. MSDS usually provides much more information, although it may not be as easy to understand. You can protect yourself from hazardous chemicals by knowing what is in the product you are working with, using the smallest amount of chemical to do a job, and maintaining machinery and equipment to prevent leaks or releases. When using chemicals, more is not always better. Smaller amounts means less goes into the air, less is spilled, or less is splashed. Equipment that needs to be maintained to prevent or minimize leaks or resistance for chemicals into the work area. Protect yourself from hazardous chemicals by using available ventilation to help reduce the amount of chemicals in the air, keeping lids or doors or covers closed on the chemical processes, wearing necessary personal protective equipment. Personal protective equipment includes gloves, goggles, safety glasses, aprons, coveralls, Tyvek, as well as respirators. PPE is a last resort when going to protect and there's no other means to protect you from a chemical exposure. In case of a leak or spill, protect yourself by informing your supervisor of unusual odors, spills, or releases, leaving an area of a large spill or chemical release. Do not ignore any unusual odors or that are stronger than normal odors. This may indicate a leak or release, and if you are wearing a respirator, it may indicate a poor fit, a leak, or a used up cartridge. Large leaks, spills, or release of chemicals may overwhelm your respirator. Do not be a hero, get help, and proceed cautiously and let the experts clean up the spill. If you have been exposed to a chemical and feel sick, let your supervisor know, find out what chemical it was, follow the first aid directions in the MSDS, get medical attention as needed, check your PPE before going back into the area. Obviously, not all sicknesses are from exposures to chemicals, but if you know you have inhaled a chemical, spilled a chemical on your sin, or ingested some and you feel sick, we want to know. Our intent is to have a safe and healthy workplace, and we want to fix any problems. Material safety data sheets. The backbone to all hazard communication programs are material safety data sheets, aka MSDS. An MSDS document gives detailed information about a material, including any hazards associated with the material. MSDSs must be immediately available to employees at locations where hazardous materials are used, handled, or stored. Safe exposure limits. The most common ones are Permissible exposure limit, PEL. It is the maximum concentration of a chemical in the air that OSHA believes that you can be exposed to without danger over a 40-hour standard work week. Then threshold limit value, TLV, similar to the PEL except it's a recommended safe exposure limit set by the ACGIH. General concepts of toxicology. Everything is toxic, it all depends on the dose. How well the body accepts the substance depends on the type of substance, the amount absorbed or the dose, the period of time of which it is absorbed, and the susceptibility and sensitivity of the person who was exposed. General concepts of toxicology. Exposure terminology. Acute exposure usually occurs in minutes, hours, or several days. Some type of immediate effect occurs. The effect is often reversible. Chronic exposure. Exposure over long times, months or years. The health effect occurs after some time. The effects may not get worse, but may not be reversible. General concepts of toxicology. Exposure terminology. Local effect. Damage to body parts that actually contact the harmful substance. Systematic effect. Damage to an area of the body after the substance is absorbed. Individual susceptibility. Some people are naturally sensitive and can develop sensitivity to a substance. Dose. Combination of concentration and a length of body exposure to a specific material. These terms are often used in the MSDS. Some chemicals can cause problems immediately. Others may not hurt you unless you've been exposed for a long time. General concepts of toxicology. Exposure terminology. Carcinogens. Carcinogens are cancer-causing compounds. Some chemicals are known human carcinogens, others are suspected as carcinogens. Manufacturers are required to list any carcinogens in their product, even if the amount is as low as 0.1%. The allowable exposure limit for carcinogens is either extremely low or is at 0. General precautions. If you're not familiar with the chemical, find out. Read the material safety data sheet. Read the labels on containers. Observe written warnings. Do not eat, drink, or smoke around chemicals. And wear appropriate PPE. This concludes hazard communications. In order to take the quiz, please copy-paste the hyperlink into your browser. Thank you.